Thanks everyone for tuning into this morning's local health department roundtable. My name is Tim Stum. I'm the editor of Wisconsin Health News. I am very excited about today's discussion. We have some of the unsung heroes of the coronavirus pandemic with us today. I am joined today by Jeanette Kowalik, the City of Milwaukee's Health Commissioner, Annette Seibold, the Health Officer for Florence County, Paula Tran Inzeo with the Dane County Board of Health, Sue Kunferman, the Health Officer for Wood County, and Doug Gieryn, the Health Officer for Winnebago County. Thank you all for sharing some of your valuable time with us today, and thank you so much for doing what you do. Before we get started, I want to make sure we thank Badger Bay Management for hosting today's event in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan publication. In addition to hosting virtual events like this one today, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can do that by signing up through the event evaluation form, which we'll email out after today's event. You can also sign up on our website at wisconsinhealthnews.com. I also want to make sure that we thank our very generous sponsors of the Wisconsin Health News panel series. I really just want to express my gratitude to these generous sponsors for their continued support throughout all of this. These important and valuable discussions really would not be possible without it. So a huge thank you to Ascension Wisconsin, Aurora Healthcare, Group Health Cooperative of South Central Wisconsin, Husch Blackwell, Marshfield Clinic Health System, Rogers Behavioral Health, and WPS Health Solutions. Today, as I mentioned, we are featuring local health officers and local health board members from across the state. From contact tracing to overseeing the safety of school and businesses, local health departments have played an outsized role in combating the COVID-19 crisis. Their prevention efforts have been instrumental in keeping the number of hospitalizations in our state at a stable level. But while we have so far been successful in not overwhelming our health system, we have in the process overwhelmed our public health system. Already facing underfunded budgets, these local health departments have been asked to do more with less. And when the Supreme Court struck down Governor Evers' statewide safer-at-home order in May, leading to an impasse between the governor and the Republican-controlled legislature, these departments were essentially asked to take the lead in responding to the pandemic, a task complicated by their own local politics. So we're going to hear about their different experiences today and learn more about what they are doing to limit the spread of COVID-19. So I have a series of questions to start things off, but then we are going to leave some time at the audience question, which we've selected through a list of questions that were submitted through the registration process. So Doug, let's start with you and your experience in Winnebago County. You issued a county safer-at-home order in May, immediately following the Supreme Court decision. But then, like most of the dozen or so counties who did so as well, you rescinded that order. Can you talk about why you did that and then some of the other steps you've taken to try to prevent the spread of COVID-19 in your county?
Sure. Thanks, Tim. Yes, we really rescinded that order based on the guidance from legal counsel. And I think we've seen since that, the work by, Wisconsin Counties Association, recommendations from the State Attorney General's office that, it was probably the right thing to do at that time from a legal perspective. It certainly was not what we wanted to do. And I think we can see that, having a statewide guidance is critically important. Since the strike down of that order, we've seen, almost chaos at the local level in terms of the ability to put measures into place that are known to be safe and effective. And clearly the governor's current order, which expires later this month, has been very effective in calming. We had the CDC in our jurisdiction for a period of time as that order expired. We had a very quick ramp up in our 20 to 29-year-old population, which we further narrowed down to that 18 to 23-year-old population. And that spiked so high that we were able to attract the attention of the state and the CDC to send a team and investigate and help us better understand what was happening there. And really, we've learned that, the opening of bars, the opening of restaurants really led to that in a college town. And while that we've recovered a bit from that, the rest of the age groups are slowly catching up to that, to those rates. And now we're continuing on an uphill trend in terms of cases. And and just from the experience we've had now over these last 6 months, we can see clearly that without another change, we are going to reach a point where we're going to have to consider some other measure before we have just incredible exponential growth within Wisconsin. We're certainly seeing a ramp up in the Fox Valley now. Things that we've done, we want to protect the hospital system. Our organization is about 50 staff. That includes about 7 staff for WIC and an environmental health team and a nursing team and a CD team. And we've repurposed almost all of our staff. We have discontinued many of our routine services, and we've hired probably about another 30 people now to help with the contact investigations, the disease investigations, set up testing sites, work on isolation sites, quarantine sites, all to help support and keep things suppressed as much as possible, because we know once we reach critical levels, we will lose control in terms of the number of cases. So it's been a really daunting task, and we have incredible teams that have really risen to the occasion, but we're really starting to wear them out. We're 6 months in, and there's a lot of fatigue going on in public health, and clearly COVID fatigue occurring in the community right now that is also leading to a rapid increase in cases at this time.
So Doug, I want to follow up a little. You mentioned that in Winnebago, like many other parts of the state, cases are on the rise again. If they rise too much, some type of other action may be needed. Are you saying like action at the county level or the state level? I mean, if cases get too high, despite your concern over the legal risks, could it get to a point where the county may have to do something on its own, like a safer at home type order?
We'd like to. We've been working towards having an ordinance put into place that we thought we always had. In communicable disease statutes, the power to, put an order in place and enforce that. And we've learned, since the strike down of Safer at Home, that we don't necessarily have the power to enforce the order that we do have the power to put out. And that puts us in a very precarious position. We've had very large crowds at numerous meetings, hundreds of people coming to our board meetings, our legislative committee meetings, speaking out against the health department having the authority to put a safer at home type order in place within our jurisdiction. That has really prohibited us from having the votes needed to move something like that forward. We're re-examining that now that Wisconsin Counties Association has come out with, additional information in cooperation with, Badger Bay and Waldab. But we're still not in a great place in terms of having an order in place. And this is why we need statewide orders to be in place in order to keep things in check at the local level. Our municipalities are looking at orders, and it's likely that we'll see more municipalities, especially with the news that's come out in the last 24 hours, that we don't necessarily expect an extension at this point of that order, or we don't know what's going to happen come September 28 when the masking order expires with the governor's emergency order.
So Doug, as we're going to talk more about today, Winnebago County is a different county than Dane County or Milwaukee County or Florence County. How would statewide guidance help you do some of these actions, given some of such the unique differences and challenges in your part of the state?
Mm-hmm. So, within the Fox Valley area, we have multiple counties and multiple municipalities that are really contiguous. That part of it is not much unlike, Milwaukee or Dane. We do also have rural areas that are incorporated into our counties. And we certainly have a varying impact of COVID right now throughout our jurisdictions from urban to rural. Having consistency through that, the Tri-County area or the Fox Valley region certainly helps balance the playing field when we realize that this is a tremendous economic burden on our communities, on on our retailers, on our restaurant and bar owners, and we're forcing people right now at the individual, municipal and county level, to make those decisions related to their economic health versus the health of the community overall, and so having an order at the state level really helps us not have to try to go municipality by municipality at this point, and have inconsistencies, and that really cause a lot of competition. And it's really those business owners that are most impacted, that have a lot of influence on our elected officials, and it puts our local elected officials in a real bind as well, trying to balance those needs. So we really need that regional level order, so that we can all operate under the same set of guidelines and circumstances, and not create these competitive disadvantages from municipality to municipality.
Great, thank you, Doug. Annette, I'm going to shift to you and talk about Florence County. So a statewide action that is in place right now, as was mentioned, is the statewide mask mandate, which Governor Evers issued last month, along with his second public health emergency. Prior to the mask mandate taking effect, Florence County Sheriff Dan Miller said that he, like most sheriffs in the northern part of the state, would not be enforcing the mandate. In a Facebook post, he said, quote, "Wear a mask if you want. If you don't want to, that is fine also. The sheriff's office is not the mask police." So I've kind of two follow-ups on that. First, what type of compliance are you seeing in Florence County in terms of the mask mandate? And second, in the absence of enforceability, what types of steps can be taken by a health department to promote prevention measures like wearing a face mask and physical distancing?
So I think some of the misconception of many of the posts that were put out by the Northern Region sheriffs right after the masking order was related to the capacity of the sheriff's departments feeling like that was really not their role or priority, which I think is understandable in the face of all that they have to do. The next day, I believe, the DOJ sent a email out that was shared with public health in summary, at least, that was sent to the DAs. And through that communication, I think that the DAs were given instruction in terms of that the masking order enforcement was really something as to their due diligence and investigation through their office. And so I think that many health departments in the Northern Region are focused on working with the sheriff's office and the DA's office in trying to alleviate some of the weight of the enforcement to the sheriff's office. And many of us have set up meetings shortly after that to create some capacity in taking people's complaints, and basically we looked at those in terms of individual masking complaints about individuals not wearing masks, and then also at facilities and the business owners. So I think that is pretty common that there was some type of process set up that complaints could be funneled and kind of appropriate follow-up to businesses to encourage their use and individuals. And as you can see, DHS is providing some media awareness campaign that we can utilize as well. And I think that people have really tried to use that. I think that you're probably correct that it's not completely utilized here, and I just would speak for the Northern Region in totality. However, definitely we have seen an increase in use of masks, at least I can speak for in our county. And I think honestly that is related to the uptick, as Doug had spoken of, that we are generally seeing, and people's responsiveness to that. And then also, of course, facility outbreaks that we've all experienced.
And in terms of compliance with the mask mandate, is there concern that if this public health emergency does expire at the end of the month without being renewed, that compliance could go back down, or do you think people are starting to incorporate it into their routine and this is something that will continue?
I think that compliance is going to be pretty challenging to implement, as Doug was referring to. It is, more consistent to be able to enforce it when it's seen across the different counties, and Florence County borders Michigan, which had the statewide order prior to Wisconsin passing it. So I think in some ways it was a little bit easier for us to be supportive of it because we were seeing it when we crossed over just 15 miles from our county to the Michigan border.
Great, thanks, Annette. We'll come back to you, but I'm going to shift to Sue now. Sue, can you talk to us about your experience in Wood County, both in the wake of the Supreme Court decision as well as Governor Evers' mask mandate?
Sure. Well, we had similar experiences and varying compliance, I would say, with the mask mandate. We have very conservative leadership in Wood County. In fact, if you come to a Board of Health meeting, you might see the chair not wearing a mask in a meeting in a room with other individuals. And so it's challenging from our staff perspective to see that happening. But we try to stay positive. We implemented a public education campaign around masking. We created a very positive and uplifting public service announcement, a video with a number of community partners, and pushed that out. People have appreciated the positive messaging, I think. Our compliance is not great. It's good in the schools, thankfully, but I am concerned that when the order expires on September 28th, that even some of our school districts may not require masks in school, and that's going to create issues for us. So we've been trying to staff up and prepare for an additional surge. We've brought on about 25 additional limited term employees to help us with this response and anticipate it to continue to get worse, unfortunately, before it gets better.
What about statewide guidance? Do you agree with Doug that this would help your department implement some of the measures you are looking at, or is your county a unique county, your region a unique county that has different needs and challenges than other parts of the state?
I would strongly prefer statewide guidance. I think it makes it easier on all of us to have some sort of uniform guidance that the public is able to follow, that we're able to follow and hopefully enforce. It's very difficult when you look at different rules from jurisdiction to jurisdiction, and we end up inadvertently putting pressure on each other by having different rules between counties, between health departments. So some sort of statewide uniformity would be extremely helpful. And I honestly kind of feel like I've had my head in a vice since March. You've got the side pushing to do something, do orders, and then you've got the other side pushing, don't you dare do orders, it's not appropriate. So uniform guidance would be very much appreciated.
Great, thank you, Sue. So we're gonna go to Paula. Meanwhile, in Madison, the Dane County executive and the mayor of Madison, who by most definitions are pretty progressive, has received pushback from city council and county supervisors for not doing enough to respond to COVID-19. Meanwhile, the public health department is being sued for closing private schools for grades 3 through 12. We'll get more into what's going on with the university a little later in the program. But for now, Paula, can you just talk about some of the pushback that Dane County's public health department has received for its actions in response to COVID-19? And before you start, could you just talk a little bit about your role? So unlike the other panelists, you are not a public health officer. You're a member of the Dane County Board of Health. Just tell us a little bit about that role and then the relationship between the Board of Health and the public health department.
Sure, absolutely. So as a Board of Health member, we work with our local health officer in the local health department to provide guidance and also, in some cases, governance. But it's been a really wonderful partnership with our health officer. And I think another unique component about our Board of Health is that we both have a city scope as well as a county scope. So the sort of competing jurisdictions with a strong mayor and a strong county exec, strong city councils and strong county boards all having lots of engagement and lots of opinions. So I think Sue's metaphor of a vice was really resonating, because there's been really strong opposition. We've seen that in Board of Health meetings, and there's for decreasing the level of orders that are out there, but also a lot of folks criticizing our leadership for not doing enough, right? So I think that vice metaphor really applies here too. In terms of the work that we're doing, as a Board of Health member, I feel like our role is to really support our local health officer and the team to use the best available data and evidence to make sound decisions. And I've been really proud of our health department for being on the leading edge of using data to really inform a stepwise approach to putting out local orders. We do have orders in place around the way businesses are opening, as well as encouragement and limitations on gathering, as well as a mask order that was in place before the statewide order. That has really helped us keep our numbers low until recently with the universities opening, which we are contending with, as several of my colleagues are on the line today, with the unique jurisdiction then around state-run agencies like the university, and needing to negotiate around different approaches to opening and planning for containment and outbreak response.
So Paula, as you mentioned, Dane County is one of the few counties in the state who did issue an order following the Supreme Court decision, and has stuck with that order. How do you respond to the question which was brought up by Doug, and just a belief that many of the counties in the state have initially come to, that these broad prevention orders may not be legal, like the one that Dane County has put forward?
Yeah, I think what we've found is that health officers do have the authority to put out orders. I think the question has been around the capacity to enforce. And I think that's where jurisdictions around the state, as well as their legal counsels, have asked a lot of questions about how that happens, because that, depending on the legal counsel's role in putting out orders and supporting leadership to enforce them, there's been a lot of different interpretations around what that looks like. And even at the state level, and I'm not a lawyer, but as I understand it, our state leaders did have authority to put out orders, but maybe didn't go about it through the right administrative channels. So I think that has created a lot of confusion at the local level, because those similar channels look different legislatively. So I think the level of interpretation around process, authority, and enforcement are still, I think, up for debate. And I think in Dane County, we've decided to move ahead with the order, and certainly are getting the legal pushback now, and we'll see where that takes us.
Great, thank you, Paula. So we're going to switch to Jeanette now, and we will come back to you like everyone. I think one takeaway we are hearing is that it's very stressful right now to work at a local health department. I think anytime when kind of the universal thought is that it's like having a vice on your head, that's not a good thing. And that's on top of just the personal stress of just living in a world where a global pandemic is raging. Local health departments across the country have had major issues with staff burnout and staff turnover. Jeanette, you announced last week that you were leaving the Milwaukee Health Department for a job with a Washington, D.C. nonprofit. You said in a statement when you announced your resignation that, quote, "I am limited due to factors that are out of my control." In subsequent interviews and articles, including an op-ed with the Daily Beast, you talked about the pushback to public health that you received from state lawmakers, and as you term it, the constant power struggle you faced, which has included racism. Can you expound on why you are leaving now, and what you meant when you said that you were limited in your role with Milwaukee?
Sure. Thanks for the opportunity to join today's panel. Yeah, I recall last year we were at somewhere. It was nice though. We were all together. But nonetheless, definitely we're in a pandemic, and we will be in a pandemic for some time to come. I came to that realization maybe about a month or so into our response. So the city of Milwaukee and Milwaukee County, our first case was on Friday the 13th. And then from that point on, it's been insane. So we know that public health has been chronically underfunded. So even before all of this federal CARES Act money, we were still struggling. I mean, our health department was in a state of repair. We were reorganizing and really helping the department get to a better place to fulfill the essential services of public health, which was updated yesterday, by the way, and has an equity center. So that's good news as we move forward, but that work needs to be funded adequately. So for instance, our department does not have an electronic health record. That prohibited us from providing COVID testing through more of a community drive-up or walk-up type of process. We were getting pressure from a variety of partners that were like, well, the health department's not doing anything, you're not testing. We're like, we don't have the ability to test. One, we don't have the system set up, but we also didn't have the staffing capacity to do it. So that's very frustrating because, we were doing our level best considering the circumstances, and we still had to wait until we actually received federal funding for COVID. That wasn't instant. So there was an assumption that we just got this slush fund of federal money, millions of dollars. By the time it showed up, we had to use other resources. So we were grateful that some local foundations and Advancing Healthier Wisconsin had stepped up to provide some funding for outreach and support. But again, we didn't have all of the systems and the resources set up on the front end. So that really showed through our COVID response. I think now we're at a better place, but we're still concerned about funding in 2021, which is another reason why I'm heading to Washington to help advocate for public health funding at all levels. So it's not just city of Milwaukee or the state of Wisconsin, but every state and jurisdiction within our country is struggling with the same thing, public health being chronically underfunded. There needs to be better advocacy and lobbying for public health in general, and not just as we have funding because there's a pandemic. There needs to be this sustained investment. So I say that because, to have hit a wall during this pandemic and not being forced out, some health officers have been forced to leave their posts due to fundamental differences in authorities for health officers, looking at orders and not issuing orders or enforcing the orders. And thankfully I had support, but just in my jurisdiction, just city of Milwaukee, which is a regional situation. It's not just in the city limits. We have many people that live and work, throughout the whole area, the southeastern Wisconsin area. So we had, not having the ability to have a regional approach to orders and enforcement of the orders really created a lot of unnecessary pressure and I think took away from some of the support for what we were trying to do. We were getting complaints about, well, you're hurting businesses because, these other jurisdictions that are just across the way, the bars are open, the restaurants are open, they're stealing all of our business, places are shutting down. So just that whole tension there because of this interpretation of the Supreme Court ruling. I mean, our city attorney, we had a changeover through the April election, but the new city attorney still held the same position that we were in our rights to issue orders for the city of Milwaukee. So, again, within our jurisdiction, within our city, we were able to have something, but not having a regional approach to COVID orders and enforcement of those orders created many concerns for us moving forward because, as schools reopening and we're moving into the colder weather months, we're going to see an increase of cases. And our goal is, we want people to continue to wear their masks and embrace mask wearing, but we also understand that that's even now a political statement. If you wear a mask or if you don't, are you for Trump or against Trump? I mean, it's ridiculous that we even have to talk about this, but that's what has been done in our country, that COVID has been manipulated. And we were even, you think about other pandemics, you think about HIV or AIDS when that first hit the scene, how gay people were being scapegoated and targeted. So, we shouldn't be too surprised what we're seeing now, but we should know better. I mean, why are we still going through these exercises at this point in time? We should have learned from our past. So.
Great, thank you, Jeanette. So I'm going to shift now to contact tracing, one of the most vital roles of a public health department, something that public health departments have been doing for a long time to try to tamp down outbreaks. This is not new to COVID-19, but never before have they been asked to do this at such a level. And the hurdles are many for programs across the country. There's been a lot of cases already. Tests are being turned around too slow in many parts. And there's just a natural distrust in government in our country that's maybe not as prevalent in some other countries. Doug, so I'm gonna start with you, go back to you. Tell us about your experience in Winnebago County so far with contact tracing. Have you been able to keep up with contacts so far?
Thanks, Tim. Yeah, we started hiring on additional staff pretty early in the outbreak, and our goal has been to be able to reach out to every positive case within 24 hours of receiving that case information, and then also to be able to reach out to the close contacts of that case within another 24 hours. So really within 24 hours of identifying it. The trouble with some of that is there's reporting lags. We have an electronic surveillance system that has been overwhelmed, I think, by COVID. It takes time for reporting to occur, and as we have more cases, it is taking occasionally longer for the health department to actually get that information. And I think most recently, we're being contacted by people that have received a positive result, expecting that public health is just going to immediately call them when the provider has to put that into WEDS, and then the health department has to retrieve that information and then assign that and make that call. So to date, we've been able to keep up just because we've hired so many staff. Although we put out a weekly report, and for the first time, we're reporting our contact tracing as borderline in terms of our ability to keep up. We've had to defer cases to the state. The state is in a red zone right now. They don't really have the ability to take on additional cases for follow-up, and despite our efforts to keep continually hiring new persons, we're getting to a point. We had quite a surge in cases from over the weekend. There's been a lack of testing in the Fox Valley area. We were fortunate to have a wing site or a National Guard site put in our jurisdiction. We had on Tuesday, when it was open over the 4-day holiday, when it was not open over the 4-day holiday and open on Tuesday, we had well over 700 people seek tests, and we're seeing a higher positivity rate now as well. And that also tells us that we don't even have enough testing. So on the contact tracing part of it, we're reaching a point where we're not sure how much more capacity we need and how long we're going to be able to hang on, because the curve of these cases is getting steeper, and we are as more people in the community become infected, and we maintain that same R0 or approximate ratio in our Fox Valley, or reproductive rate in the Fox Valley about 1.2. We're just going to reach a point where there's going to be so many more people infected that we're just not likely to have the capacity. And we're already now, with the surge from the holiday weekend, looking at where can we pare back and just reach people, knowing that we're going to have to follow back up them later and not be able to do as thorough of an investigation as we'd like to. So we're near a breaking point, and And that's something we're looking at hard right now. And there's just not going to be the funding that has been made available, which initially the CARES funding that had, that came to health departments, look like it may be adequate. I'm really questioning right now if we're going to have enough funding and not have to dip into local funds. And right now we have, really no certainty in terms of if that funding is going to continue into 2021. And we're asking people to make commitments to us to work on contact tracing and stay with us over a long time period. But right now we can't, it's hard for us to make any promises about whether or not we're going to have the funding to continue those positions.
Thanks, Doug. Annette, what's been your experience in Florence County, and what's been the response? I mean, are people picking up the phone when you make these calls for contact tracing? What's been the response, and how is your program going so far?
So we've tried to provide a media campaign local here to encourage people to respond, and have used DHS media as well. I feel like thus far we have had good response from the community in terms of picking up the phone, and it is challenging though. Once the Safer at Home was done, the amount of contacts that individuals had, created a burden for, I think, local health departments that we hadn't seen before. So, in the past, if you had a positive contact that had maybe 4 close contacts, that was capacity-wise something that we'd be able to handle. Most recently, we're seeing ones that have 10 to 30 contacts within that 48-hour communicability period. So that definitely increases the amount of time that's required for contact tracing. And then also, you're basically asking people to stay at home and trying to verbally get a hold of them through direct contact through a phone, which can be challenging. And that they are needing to give us information of their close contacts. So people feel sometimes that that's personal information. They don't want to be giving that information. So there are a lot of challenges with contact tracing that I think we all feel.
Thank you. Sue, what about Wood County? How's your program going, and maybe what are some of the challenges that you are facing right now?
We're facing many of the same challenges that Doug and Annette described. Funding is certainly an issue. Our public health system, as was mentioned earlier, has been underfunded forever, it seems. Wisconsin ranks 47th lowest in the nation in federal funding that comes to support our public health system here, and that's a problem. We really need our policymakers to help fix that. But we're seeing a lag in getting testing results back. There's times we get a positive result back and the person is already out of isolation because 10 days have passed. We're also having problems accessing testing. We have symptomatic individuals seeking care and they're not able to get a test because we don't have the supplies in Wood County needed to run those tests. There's some trust issues. We work for the government. We're here to help you kind of a thing. We are finding more people who are not answering the phone than we did initially. That's becoming more of an issue for us. And we're seeing more people kind of playing the system as well, just not giving us contacts because they don't want their friends and family to be quarantined for 14 days. They need to continue to work. So they're just not sharing information back and forth to avoid isolation or quarantine. So we're kind of seeing that whole gamut. We do have a lot of people who cooperate with us, who are very kind, very willing to follow our guidance and stay home. So we appreciate that when that happens, but it seems as time passes and people do become more fatigued with this whole issue, the compliance rate just seems to be going down.
Thank you, Sue. Jeanette, the city of Milwaukee is one of the bright spots, relatively speaking, in the state right now for COVID-19. Case counts are trending down, but they're still averaging more than 70 a day, and it wasn't too long ago when they were averaging more than 250 a day. Has your contact tracing program been able to, as the county and areas contact tracing program, been able to keep up, and kind of where are things right now?
So the city of Milwaukee's contact tracing efforts have been extremely challenging, of course. Like I noted, the limited resources on the front end, where we had a small team that was like really, really, struggling to keep up with the volume. Having the Safer at Home order, as noted, helped to decrease the number of contacts. So it was a little bit easier then. I think some of the reception to public health was different at that point in time. People seemed to be more open to cooperating, but also noting that the city of Milwaukee is a very diverse community, and there is a lot of transients as well. So even with our other disease investigations, that we rarely hit 100% turnaround for contacting or successfully contacting a client within the first 24 hours. I also need to note that there was an issue, as Doug noted, with the Wisconsin Electronic Disease Surveillance System. So every state has one of these, for people that don't know what it is, but it basically serves as a data warehouse for reportable diseases. And then those disease cases are assigned to the jurisdiction where the person resides. So because of the volume of cases in the city of Milwaukee, and I say cases meaning positive people, but also negatives. So, of course, there's way more negatives than there are positives. It created quite the bottleneck for us at the local level to be able to manually destage all of these cases and assign them to us so that we could follow up on them. So within our city and county, we have 5 key indicators that we use to address the success of our pandemic response. And one of them is contact tracing. So the state's system for measuring that, the success of that, was based off of once the case is in their system, not necessarily when it was assigned to the jurisdiction or when it is assigned to the jurisdiction where the person resides. So for a long time, we were never able to hit that because we had so many that were just sitting in this purgatory, if you will. That was recently changed, so we were happy the state was able to make an adjustment to the surveillance system so that we could follow what others were using as an indicator of turnaround time and success for reaching out to clients. So since we started measuring this, which honestly started June 4th, we have not been able to meet the goal of the green, which is like a 95% turnaround time for reaching clients within 24 hours. So we had to adjust our local metric to 48 hours once we received the case of successfully contacting clients. So that range for us has been as low as 62%, which was in July 16th, so kind of in the middle of where we're at, to a high point of 92%, which was during the week of June 11th. So you can see, like, with that range in the 70s and 80s, that's where we're at considering our population, but also now that some of those technical adjustments have been made with the disease surveillance system. I think it's important to note that although data and technology is extremely important to public health, that's how we make decisions and how we allocate resources, some of the tools that we have are very outdated and archaic and can hinder us in our response. So just wanted to note that. And then right now we have about 200 people working as contact tracers for the city of Milwaukee. We brought a lot of our retired nurses back on, which is nice to be able to see some of the old guard that was around even back in Doug's day, back at the health department. But we also are creating opportunities because many of these positions are remote or telework. So it's nice for some people that may be high risk or have other obligations to be able to provide support for our COVID response, but do it in a remote way.
Thank you, Jeanette. Paula, let's move on to Dane County, which used to be a bright spot, but is now averaging more cases per day than Milwaukee, driven in very large part, as was noted by the university. Dane County said earlier this week that of the nearly 1,000 cases in the past week in the county, more than 70% can be tied to UW students and staff. I know that UW has hired their own contact tracers, and there's a call for them to hire more. But can you talk about how this uptick in cases is impacting Dane County's contact tracing program, and also talk about that relationship between Dane County's program and UW's program?
Yeah, I think this speaks, underscores what other folks have said about the importance of a statewide order. Lacking a statewide order, we get lots of competing jurisdictions, and one of those can be different cities and towns and counties, but also different agencies. So even though UW-Madison is in Dane County, it's a state agency. So Dane County does not have jurisdiction over what UW-Madison does. They've certainly been working in close partnership to plan together. And certainly people that are on campus also live off campus. So they become under the purview of the county sort of response. So they do have to work closely together. And that means the increased number of positive tests on campus does impact the county response. So it's intimately tied, but again, the absence of a state uniformity and approach creates a lot of differences in decision-making and allocation of resources. In terms of contact tracing, the county has about 70 contact tracers currently, and I think 30 to 40 are in the queue to be hired. So to the point that others made, many of our county health department resources are focused on COVID right now, and many people are connected directly solely around contact tracing. And UW-Madison is also currently, I'm not sure what number of contact tracers they have, but they are hiring more. So they're in close communication, but the different jurisdictions and the different decision-making processes does mean there are some inconsistencies in the approach, but they are certainly talking frequently to address especially the recent spikes that we've seen over the weekend and early this week.
Thanks. What about the staying on UW, but maybe shifting gears a little bit? Can you talk a little bit about the potential broader impact on the community of this uptick in cases? The health department said yesterday that if you live or work in downtown Madison, you should assume you've been exposed to COVID-19. What type of overall impact could this growing number of cases linked to UW have on the broader community in Madison and Dane County?
Yeah, I mean, I think generally speaking, the more widespread, as others said, the more difficult it becomes to trace folks' contacts, as well as get them the public health information they need to safely quarantine and isolate, and then really contain the transmission to the folks that we know that have tested positive. So as folks are engaging in their daily lives on campus and downtown and off campus, that means there's a great opportunity for even more community spread, right? So right now the numbers are mostly connected to campus, and if we don't contain that very quickly, then that will spread more widely across the county and across county lines. I mean, COVID doesn't know our county borders, right? So it doesn't just stop where the orders stop. So wanting to do our best to make sure folks get the right information they need and keep the spread low. And that goes back to our ultimate goal of making sure folks stay safe, and that we need to begin to watch then our hospital capacity. Right now, the numbers are increasing among an age that so far hasn't shown as much hospital need, and the more community spread, the greater the risk for folks that have underlying health conditions or who are at greater risk for worse disease if they test positive.
What about the impact on other schools? Right now, most students in Dane County in grades kindergarten through high school are going to school virtually. I have 3 kids at home right now on their Chromebooks, I'm hoping they don't take up too much of our internet as we do this, but they're at home virtually learning like a lot of other kids in Dane County. What type of impact could this spread have on the reopening of in-person classes in Dane County?
Yeah, I think the more community spread stays high, the trickier it is to open anything where folks are in congregate settings, right? So where they're indoors and there are many people, and the increase in transmission gets higher as more congregate activities happen. So I think the more community spread exists and the worse it is, the trickier it is for schools to open, which becomes, I think, a really challenging point for lots of local leaders, because as public health professionals, we certainly are watching the transmission of disease, but also care deeply about education and social and mental well-being of our communities. So the sooner that we all can engage in things to help stop community spread, I think the sooner we can really be safer going about things like schooling and opening up businesses.
So Dane County Executive Joe Parisi said yesterday that UW should send students living in the dorms back home. He also called for an increase in contact tracing and testing. UW, which has pushed back against that. UW then later yesterday did make a move to virtual learning for at least the next 2 weeks. They're quarantining 2 of their biggest dorms. But they, like I said, they pushed back against the county executive's push to send kids back home. And they say they have enough space to quarantine. Other public health experts have expressed concern with this idea of sending college kids who are already on campus back home for fear that they could then take this virus and spread it to other parts of their state. From a public health standpoint, what type of things should we be considering when decisions are being weighed like this? Is it better that when the college kids are already on campus, just keep them there, or maybe send them back home and maybe risk some of the spread that could happen from that?
And certainly I would invite other colleagues to weigh in on the ways we hold lots of different kinds of data and information to make really tricky decisions. I think in any decision that we make in public health, especially ones that impact this many people, there are trade-offs. And I think local and state and national leaders are weighing lots of different trade-offs. And I think the best we can do is whatever decision we make in collaboration with our stakeholders needs to hold our best available information, evidence, science, and engage those most impacted by what might happen, and then really build in the mitigation strategies, because every decision will need them. So whether it's to send folks home or keep folks here, there are ways to provide information to help folks engage in any of those alternatives in safer ways to reduce harm. We're in a really tricky place nationally and in our state that community spread is wide, so I don't know that there's going to be any single answer that's going to be without opposition and going to be without need for mitigation approaches.
Great, thank you, Paula. So I want to stay on this idea of schools, but we'll move on to some of our other panelists and talk about what's happening in some other parts of the state in the little bit of time that we do have left. Annette, let's start with you. Could you talk about the role that the county health department is playing in Florence County in coordinating with schools on ensuring a safe return for students? So in Florence County, like many other parts of the state, kids and students have gone back to school. What role is the health department playing in that return to make sure things are safe, and what type of plans are in place if there is an outbreak in some of these schools?
So we've really been working with the schools for months now on what that's going to look like. And I don't think that's unique to Florence County. I think we've been thinking about reopening ever since they, originally went virtual. I think we are looking at metrics that are provided through DHS and then our local metrics on determining the ability to continue to remain open at this time, which is what our schools here are in Florence County. They are going Monday through Thursday in person. And I really think that's going to continue to evolve depending on what our numbers are. We had a regional meeting yesterday where health officers shared that they had, in a smaller northern region school had 60 close contacts of a positive, that, that has a effect on small schools of the ability to continue to be able to provide education when you have staff that are close contacts, and then of course, whole classrooms that have been exposed. So I really think that going forward, it's going to be on a what we call almost an individual basis, and that's determined on how many kids are really able to be there as identified as close contacts of positive cases, whether those be within the community or within the school. So I think that the approach here is to try to remain open, but we have plans to move to a hybrid and also to fully virtual, and that was set up even before the school started.
Thanks, Annette. Doug, can you talk about your experiences in Winnebago County and how your experiences may or may not be complicated by not having a statewide direction on these efforts to coordinate with schools?
Thanks, Tim. Yeah, since early June, we've tried to provide information to the school districts, trending cases by their school jurisdictional footprint, so they can understand the burden in their area. Also, tracking the number of cases in the various age groups that are in schools, so they can see coming into the school year, which has already now started, how many cases do they have in a grade school environment, or at least in a grade school age within that jurisdiction, a middle school age, a high school age, and of course working with UW Oshkosh as well. I think the challenges we have is that those decisions are all local. We have suburban to rural school districts within our area. And so the decisions that are being made at the school district level are not consistent across all school districts. And in our case, I think it's worked out okay for the more rural school districts to be able to do things a little bit differently than the urban school districts. I still think a unified approach is best in the long run. However, what we've done is provided them the information, and we have regular consultation with them. Our goal is one, that they understand that they're going to have positive cases in school, but a positive case in a school shouldn't result in dozens of close contacts. It should be a very minimal number so that they can keep going. And physical spacing has really been the biggest factor with that right now. Masking, seems to be being adopted largely in part because of the state order in all our school districts. But because of masking, I think we've seen, and the interest of getting kids to school and as many kids at school as possible, we're seeing school districts make decisions about, hey, we can get away maybe with 3 to 6 feet instead of 6 feet, and then when you have a positive case, it results in a lot more close contacts and kids out of school. So school districts are learning as they go. Unfortunately, some of the harder lessons are being learned by every school district, and many of these things could have been anticipated ahead of time, and so a rule about physical distancing, for instance, in schools could have gone a long way to prevent what we're seeing in terms of these initial outbreaks that are occurring in school districts all across the state. And in terms of UWO, we need to keep kids that are being isolated or quarantined at school. We can't send them home. The most common place for someone to be infected is at home. And when we send these kids at home that may, that are in quarantine or isolated, and they infect their family members, then those family members take it to the workplace, and it just grows within the community. So we need to keep those university students, especially those that are isolated and are quarantined, at school until they've recovered.
Great, thank you, Doug. So we are sadly running out of time, but I do want to end on one of our audience questions. I was hoping every panelist could take a crack at this one. Will the events of the pandemic and the public response draw more people to enter public careers in public health, or scare them away? And Jeanette, let's start with you.
Yes, so thanks. We do need more people in public health, all positions. So not just nursing or epidemiology, but health officers. When I discussed my issues at our standing briefing, I talked about diversity of the health officer pool in this state. We need more diversity. We need more Black and brown people leading health departments. It does make a difference. This is why the city of Milwaukee and Milwaukee County, prioritizing sharing information early on about race and ethnicity related to COVID happened. It was important to be able to say, look, there's something going on here, and asking other health officers in other parts of the country, and then them sharing their information and seeing that there was a true situation related to racism playing out through the pandemic. So it's very important. And I think, just kind of what I went through and why I was transparent about my experiences, and I'll provide more details along the way, it is a very brutal, difficult position to be in. So there needs to be better supports in mentoring and coaching and sponsorship of us in these positions, because otherwise you're pretty much all by yourself. And, it's a very difficult spot to be in. I'm not trying to scare people away. I'm trying to be realistic that there needs to be better supports. I mean, I know that there's been some of my colleagues in other parts of the country where they have police escorts, picking them up for work every day and taking them to the office. There has to be some better supports for us. And thankfully I live in a very secure place, so I didn't have to worry about someone trying to come up or do anything harmful to me. But just to receive threats and things that are very vile is very jarring. And I think health people that are considering moving into health officer roles now during this pandemic need to understand that there is going to be some of that to a certain extent.
Thanks, Jeanette. Paula, what do you think?
So a lot of the work that I do in my day job at the Population Health Institute is around recruiting folks into the public health workforce. And I think there's so many different ways to be involved in public health. You could be a health officer, like many of my colleagues are on the line today. And the definition of public health is what we do collectively to assure that everybody can live up to their full potential, right? So that means you could be a health officer and be really in the thick of it when there are emergencies, and also you could join, like I have, as a Board of Health member and help guide and direct the direction of a health department. And from any sector, whether it's planning, community development, infrastructure, transportation, all these things impact health. So I hope folks do join the public health workforce proper, and from whatever seat they're sitting in the world, there's a role to play to support public health and the decisions we make as communities to assure that everyone can be as healthy as possible, and work in partnership with our public health colleagues that sit in governmental spaces.
Thanks, Paula. Sue, do you think that everything going on with this pandemic is going to draw more people to public health, or scare them away?
Well, I think both of those things are going to happen. I think this pandemic has highlighted public health, both our successes and perhaps our flaws as well. And I think there will be a segment of people who weren't aware of careers in public health prior to the pandemic who are more aware of our work now. I also think there will be some who witnessed us being beat up and will want nothing to do with that, unfortunately. I think my bigger concern is maintaining the workforce that we have once we get through this, and working with our policymakers really to assure we build and maintain a stronger public health system that is fully supported and has adequate capacity to meet the needs of our communities ongoing.
Thank you, Sue. Doug, what do you think?
Yeah, I really wholeheartedly agree with a lot of Sue's comments there. Our current workforce is being pushed beyond limits. It's been difficult at a local level to find ways to help keep them intact, and at least even provide them rewards financially for the many hours that they're working. There are so many public health staff that are working 60, 70 plus hour weeks right now on a salary, and really with no mechanism for any additional compensation, not able to take vacation. I mean, we're 6 months in, and most of us haven't had a day off yet, and it's been 7 days a week. So preserving our current workforce is really, really important. And I agree with Sue's other comments. It's a challenging time. We're all facing, anger and attitudes and attacks that rock you to the core, and that's not something we're used to. I mean, we're used to being a neutral, trusted entity in our communities, and this has been politicized. We're not following the science, and so we're getting in some pretty tough places with county health departments being able to effectively respond. And we have to get the politics out of this. We have to get back to the science, and we know how to fight this. We know how to minimize this, and we know how to cause less damage economically as well. We're just not doing it.
Thank you, Doug. Annette, we'll give you the last word. Is this all going to bring more people to public health or drive them away?
I think that that question will be yet to be answered. I hope, as Jeanette mentioned, that it does bring more people of color to public health, and that it increases health equity, so that we can really look at that in the state of Wisconsin. We have some real issues all over the state that needs to be addressed. And I think that is priority area that can help us move public health in addressing those disparities. I also think that, the conversation related to nationally what's happened in terms of public health has happened here in Wisconsin. I'm on a morning WALDAP call, and I have been surprised at how many health officers are literally going through opposition lines to get into work, or need to be physically escorted from a committee member or a committee in the evening to their car by police officers, or have been publicly derailed by in the media. So I think that it is a very challenging time, and that answer will be yet to be determined, I think. I hope that we can continue to be a trusted force in this pandemic, because for us to really collectively move forward in it, we need to be.
Well, thank you, Annette. Thank you all for really a wonderful discussion today. Thank you truly for all that you do. Thanks to everyone for tuning in, and thanks to our generous sponsors for making today's important discussion possible. Thanks, and have a great day.